Welcome to Health Organizers, your digestive system specialist. In our Health Bites, we strive to provide you with just enough information to chew on so that you can understand how to care for your digestive system, also known as your hole in the middle. On this edition of Health Bite, we will discuss the cancers that can be found throughout the digestive system. Now, you recall that the digestive system is the mouth, it's the esophagus, it's the stomach, it's the small intestine, the large intestine, the liver, the gallbladder, and the pancreas. All of those working together to compose your digestive system. And we can have cancer in any of those areas. So typically, the risk factors for developing cancer could be many. Generally speaking, just as with cancer in any other area of the body, aside from the digestive system, risk factors for developing cancer can be environmental exposures, it can be nutritional deficiencies, it can be an autoimmune or where the immune system is attacking itself. Again, cancer is something that develops over time. It is essentially just a state of the body continuing to make cells that should have a life cycle, meaning they should be born, they should have middle age, and then they should die. Well, with cancer, essentially, the cells just continue to be born and replicate and never die. And then they can either be benign, where they stay locally in that area and don't really cause much trouble other than the fact that they're growing and disrupting function that way, or they can be malignant, where they're actively damaging the area, ripping things apart, and then also traveling or metastasizing to other areas of the body. Now, as far as risk factors specifically for oral cancer, they can be things like smoking or excess use of alcohol. For esophageal cancer, it can again be smoking, excessive use of alcohol, as well as acid reflux or gastroesophageal reflux disease, where again we're continuously burning the esophagus. That can lead to esophageal cancer. In the stomach, again, we can have exposure to certain bacteria such as Helicobacter pylori, as well as exposure to environmental toxins. The nitrosamines found a lot in your canned foods can lead to stomach cancer. When we think of the liver, it could be due to exposure to the hepatitis virus or chronic use of alcohol or excess use of alcohol. When we think of the pancreas, it could be also due to excess alcohol use and or blockage of the ducts that connect the pancreas to the gallbladder, meaning gallstones, for example. And as in the small intestine and large intestine, it could be due to, again, nutritional deficiencies, environmental toxins, polyps. So that concludes this edition of Health Bite on cancers in the digestive system. Be sure to find us on the web, healthorganizers.net, like us on Facebook, and follow us on Twitter. I am Dr. Megan Levon, and remember, Health Organizers, working with you to tidy up your health naturally.